Krystal, what are you taking a look at?
Well,
I'm pleased to say that more Americans have health insurance now than ever in history.
but that was then, and this is now. 15 million Americans are set to be kicked off of Medicaid starting this month, leaving many without any health insurance and a health care plan that basically amounts to just pray that you and your kids do not get sick. A devastating, unnecessary calamity being intentionally inflicted on millions by their own government, one that has been effectuated by Democrats and Republicans acting in concert, and which, outside of this Washington Post coverage I just showed you, has barely registered with the news media that is blissfully insulated from the impact of all of these policies. As friend of the show Jeff Stein put it, pretty remarkable that America temporarily constructed a safety net during COVID, including major health care coverage, food benefits, anti-poverty funding for families and kids, etc., and then just systematically and slowly demolished it. With regards to the millions about to be kicked off their health care, the process has a bureaucratic and antiseptic name: Medicaid unwinding. Basically, during the pandemic, states could only gain access to certain federal dollars if they pledged not to kick anyone off of the Medicaid program. That means that women who had had a baby and would have only qualified until just after the baby was born, they were able to stay on. It means people who may have missed their renewal notices in the mail were able to stay on. People who struggle to complete the mountain of paperwork in time to prove they are sufficiently poor to qualify, they were also able to stay on. And that last category, it might sound small, but it's actually massive. HHS estimates 7 million people will get kicked off of Medicaid who actually qualify due to issues like long wait times, bureaucratic mistakes like sending paperwork multiple times, and missing renewal notices. That could be an especially large problem because of how many people have new addresses due to housing instability exacerbated by the pandemic. Millions more of the working class fall into a giant coverage gap because they live in states which did not expand Medicaid. So those individuals make too much to qualify for Medicaid, but then not enough to actually afford plans on the ACA exchange, even with the subsidies. The Washington Post interviewed a single mom who was set to lose her coverage on just how devastating this is all going to be to her life. So Connie Bunch is mom to a toddler son and a 10-year-old daughter who has cerebral palsy. Caring for a disabled daughter and struggling with her own health issues has made it nearly impossible for Connie to be able to hold on to a job, and certainly not one with health benefits. She was only able to stay on Medicaid because of those pandemic-era provisions. That's a benefit that she believes actually saved her life. It enabled her to go to the emergency room one evening when her face began drooping, resulting in a diagnosis of Bell's palsy and also the discovery of several small brain aneurysms. Now, Connie is also among the millions who struggle to afford insulin for her diabetes and medication for her high blood pressure. After Medicaid unwinding, who knows how or whether this mom will even survive to be there for the babies who so thoroughly depend on her. But the truth is, gazing at this tangled healthcare mess is to realize how broken the system is, even at its very best. A vast, expensive, dehumanizing bureaucracy is required to determine who checks all the right boxes and lives in the right state to be worthy of basic care. It's actually going to cost states quite a bit of money to figure out who they can kick off the program. Money that, of course, could instead be spent making sure moms like Connie have the care that they need. Social safety net programs that only benefit the poor and working class are also incredibly politically vulnerable, as low-income Americans have zero political sway in Washington and little visibility to the national media. Consider how toxic it is for politicians to even consider cutting Social Security or Medicare, and compare that to how the child tax credit, rent forbearance, expanded unemployment, and now Medicaid for millions are stripped away, while Democrats are in power with barely a whimper. Why? Because Social Security and Medicare are near universal programs that every American feels they have a stake in. Means-tested safety net programs are ghettoized as welfare for the unworthy. And in the current political climate, they've also been blamed for inflation, even as spending for bank bailouts and corporate subsidies is just accepted as a matter of course. What's more, the overwhelming majority of political journalists grew up in at least the middle class and have had zero personal experience with any of these programs. They also live in class-isolated bubbles where their only interactions with the beneficiaries of safety net programs are through the service workers who deliver their Uber Eats or care for their kids. Journalist Jeff Stein has made sure to document the stories of those for whom these programs have been a precious lifeline, which has now been cut away. He wrote a while back about a single mom who has slowly slipped back into financial desperation as program after program has been demolished. In her words, "It was a weight lifted like I can't describe. I could actually buy what I wanted to at the grocery store. Living is so much harder now. That this brutality is being inflicted quietly, surgically, under Democrats makes it all the more galling. After all, Joe Biden pretended, at least on the campaign trail, that he was going to fight to get all Americans health care through a public option. Now, that was never as good a solution as Medicare for all, of course. At least it was something. Now, we watch him surrender 15 million Americans to healthcare doom, and he doesn't have a single word to say about it. I will close with this. Our country is facing a life expectancy calamity that is unlike anything happening anywhere else in the developed world. The Financial Times recently crunched some of the data, and they found that Americans on average have life expectancy as low as Blackpool, that is the most economically depressed town in all of England. What's more, while all countries saw life expectancy take a hit during COVID, the U.S. took a bigger hit and has failed to bounce back as other nations have done. Now, the causes of this are myriad, but I think in a way, the story of Medicaid unwinding tells you everything you really need to know. In America, we don't actually value the lives of everyone, not even close. The country is run according to a radical, elite-driven ideology which says your human worth is equal to your market worth, and which is then actively, intentionally sought to make every human of as little worth to the market as possible. And that sick, amoral ideology leads Democrats and Republicans alike to just accept these deaths as a matter of course. Republicans don't really even pretend to care. Democrats pretend to care, but will do nothing that is even remotely hard or counter to donor interest to try to deal with the problem. And so millions get tossed out in the healthcare cold, and our elite institutions barely even register a loss. And Sagar, I was thinking a lot with regard to these, 15. Hey guys, ready or not, 2024 is fully upon us now, and Sagar and I have been brainstorming ways that we can really up our game for this critical election.
Yeah, we rely on our premium subs to expand our coverage, to add staff, to upgrade the studio. We just want to give you the best independent coverage of this election, which is possible. So if you can help us out, become a premium subscriber today, breakingpoints.com, or the link is down here in the description video. It really means the world to us. And if you like what we're all about, this is the best possible way to keep us 100% independent, working only for you.